Hello, everyone. Thanks for joining us today. I really appreciate you taking the time out of your busy schedules. Can everyone hear me okay? I apologize.
Yes.
I just want to make sure if you're able to hear something, Hello? Hello?
Yeah.
Okay. All right. That's a lot better. So again, thank you for joining us today. I'm just trying to close out of this. Okay. So I'm sure many of you are familiar with the ARC, but we just going to go over quickly. We're in an umbrella organization with about 17 chapter affiliates, and we work with provider, government, and advocacy agencies, and we work to protect and promote the rights of millions of Americans with disabilities. And the ARC of US is the largest network advocating with and serving people with intellectual and developmental disabilities and their families. Our mission of the ARC is to enhance the lives of people with intellectual and developmental disabilities, including autism and their families. And we fulfill this through advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. So I just wanted to start today with some statistics on the coronavirus. As of yesterday, April 2nd, in Massachusetts, we have almost 9,000 total cases, 154 deaths, 813 hospitalizations, and about over 56,000 patients have been tested for the coronavirus. So things are happening very quickly, and it's scary times, and we really want to make sure there's a lot of fast-moving policy decisions that are happening around COVID-19, and we just want to make sure that we're educating legislators about the needs of people with disabilities during this difficult time and this state of emergency that's concerning people's health and safety. And so that's what I'm going to talk about today. I'm going to go over the first and second congressional COVID-19 relief stimulus packages pretty quickly, and then kind of go in a deeper dive and review the third COVID-19 relief package. And then I also want to go over what we've been doing at the ARC, particularly the ARC of United States, which they've been working tirelessly to give us all updates and make sure that the disability community is being heard on Capitol Hill and within the administration. And we'll talk about what's next as far as our advocacy. And then a few other federal issues surrounding COVID-19. And then we can end with some of the updates around what we've specifically been doing at the ARC of Massachusetts. So first, the first COVID-19 relief package, which was the Coronavirus Preparedness and Responses Supplemental Appropriations Act, became law on March 6th. And basically what this did was provide emergency aid. So it was about $8.3 billion in emergency aid for federal agencies to respond to the coronavirus outbreak. And much of it went to our domestic response, going to HHS and other federal agencies. And then a part of it went to international response. So the second COVID-19 package became law on March 19th, and that was the Families First Coronavirus Response Act. And so in relation to people with disabilities, this was the 6.2 federal increase for state Medicaid programs, which is a federal match to FMAP, and it gave us an FMAP bump to put federal dollars into state budgets. So that was a really important addition. But we still need to continue our advocacy and reach out to Governor Baker and our Medicaid offices and Mass Health and ask to make sure that these additional funds that go to the important needs of the disability community and also the DSP workforce. Some other items include emergency requirements for all health insurers to cover testing, expanded unemployment insurance, expanded nutritional assistance, and limited pay sick day and paid leave provisions that unfortunately did not include caregivers for people with disabilities. So the third package was by far the largest relief package that Congress and that President Trump signed to date. And that gave over $2 trillion in relief. And so we want to go over some of the ways that it impacted or impacts people with disabilities. So we're happy to report that it includes nonprofit organizations that receive Medicaid funds in the Small Business Loan Assistance Program. And that allows service providers to access funds to continue operations as we still continue to advocate for additional funds for home and community-based services for our workforce. But it's a good start. There's also tax credits to cover the cost of paying for paid sick leave or paid sick days, and expanded FMLA are made refundable. And the IRS is issuing forms and guidance for businesses to use regarding this. The Money That Follows Person program and spousal empowerment protections are extended through November 30th. And we're going to be continuing advocacy around this, but if there has been this extension, we want it permanent. And then it also allows people receiving home and community-based services under 1915 waivers to have their direct support professionals assist them during a short-term hospital stay. And prior to this bill, this level of support was not allowed under Medicaid. So it will assist individuals with the continuity of their services and who end up hospitalized. And it also supports them with their transition home after they recover. It also includes new stimulus payments. So for individual payments, it's about $1,200 for low-income people, $2,400 for married couples who file jointly, and $500 for each dependent child under 17 years of age. And the good news is that the payments are not counted as income, and they're not counted as assets for 12 months. There was also recent Department of Treasury guidance that allows Social Security beneficiaries to automatically receive payments without filing or have filed tax returns. Unfortunately, this guidance did not include people who receive supplemental security income or certain veteran benefits. So those people still need to file or have filed 2008 taxes or need to file 2009 taxes to receive payments. So this is really something that we need to continue our advocacy, because there was a great deal of advocacy that pushed Treasury to allow Social Security beneficiaries to automatically receive the payments. So we just want to continue on with our advocacy in that regard for others receiving SSI and veteran benefits. And for medications, there's mandated access to a 3-month supply of medications. However, that's for people on Medicare that need to isolate because of their pre-existing condition. This does not include, unfortunately, it does not include controlled substances, which can include medications that are used to treat seizures and other conditions. and Medicaid and private insurance coverage are not included. Regarding education, there was almost $31 billion in education funding to support elementary and institutions of higher education that can be used for various education programs, including IDEA. There is a directive, unfortunately, for the Secretary of Education to make recommendations for waivers around education laws, including IDEA, which we adamantly oppose. We don't think it's needed, obviously, and that's another part of our advocacy that will continue. The Secretary has 30 days to file this report and recommendations to Congress, and then we have an opportunity if there was some sort of recommendation that would harm IDEA in any way. We have an opportunity to advocate Congress to prevent that from happening. Hopefully it won't. Our position has always been we want full funding for IDEA, and we'll continue with that message. And there's no need for waivers. I did want to mention that there was guidance from the Department of Education that was issued. This is unrelated to not related to the COVID-19 package, but related to issues around COVID-19. And it did make clear that ensuring compliance with IDEA should not prevent any school from offering educational programs through distance instruction. And we have all of that information up on our website. I just wanted to highlight that that was something that happened last week or on March 21st. So we also had a great deal of housing funding. So there was funding for HUD programs, including $4 billion for emergency solution grants for homeless assistance, $5 billion in community development block grants, $1.25 billion for the Housing Choice Voucher Program, $1 billion for project-based rental assistance, and $15 million for Section 811 housing for persons with disabilities, along with many other important programs. It includes a time-limited foreclosure protection for homeowners with federally backed mortgages. And there's a broad moratorium on eviction for tenants with subsidized rent. So what is needed moving forward? Again, we want to make sure that our message is being made to Congress that, while there was some improvements in the third package, they have not addressed a lot of the critical needs of people with disabilities, their families, and the direct support professional workforce. As I mentioned earlier, and as everyone knows, we're facing this health and economic impacts of COVID-19, but people with disabilities are particularly vulnerable, and they're more likely to have underlying health conditions and live in poverty. And this means that they're disproportionately impacted and they need ongoing support. So moving forward, we just have to make sure that they are included in what Congress is doing. And we expect that Congress will have a fourth package. So what is needed moving forward? We need adequate Medicaid funding to ensure that states can provide care to everyone who needs it. We need HCBS grants to support the direct support professional and home healthcare workforce, and to support people with disabilities in their homes and communities. And this was a priority for us that was did not end up in the final version of the third package that was passed. We need acknowledgement for DSPs and providers have personal protective equipment and other medical supplies, and this puts them at an incredible risk at their workplace, and so it's needed for our workforce. We're also asking for a permanent extension if money follows the person program. This program has received short-term extensions 5 times by now, and it just increases ongoing uncertainty around the program. And it really was a missed opportunity to make it permanent in the last relief package, so the states can fully use the program and deinstitutionalize as many people as possible. And, this is a big concern around the idea of institutionalizing people with disabilities. Again, given what's going on, that is such a scary thing to think about. I recently heard about a Texas institution that has over 40 people, that it houses over 400 people, and it has about 40 cases of COVID-19 right currently now. And so it's just important that Congress realizes that we have access to community-based services so that individuals can be safe in their homes and in their communities. So as mentioned previously, there's it's difficult for people with SSI to easily get their stimulus rebates. And we think it's an easy fix that SSA and IRS could do in a few days with a new form that they send to Treasury. And so we're asking both the administration and Congress to fix this problem. There was a boost to Social Security or SSI, but no new SNAP funding. It's providing money from a commitment that was made in the last bill, so it's not any new money. So there will be unmet needs during this time of crisis, and so we're asking for additional funding there. And then, as we mentioned before, the need for the 3-month of supply of medications for people on Medicaid or other health coverage, making sure that the Medicare provisions cover controlled substances as well, because we know that that's leaving out a large number of people with disabilities. And then finally, a moratorium on all residential evictions. Right now, there are some for renters and homeowners, but many are still unprotected. And so there needs to be a moratorium. Currently, we need to have moratoriums at the state or local level. So we want to make sure that there's a full-on federal moratorium on any sort of foreclosures or evictions. So that's basically the summary of what was in the last package and what we are continuing to advocate for. I just want to make sure you're aware, if you're not already, of the We Are Essential campaign that's going on that the ARC of US is leading. We want to, include that message that people with disabilities are essential and must be included in any sort of coronavirus relief bills that are moving through Congress. And we want to make sure that legislators are hearing why we are essential. So there's action alerts that the ARC of US that we have on our website, and we'll continue to circulate on social media. And you can call Congress, you can email Congress, you can tweet Congress, and all of the action alerts get updated as things happen. So if there's any changes on guidance, for instance, the recent Treasury guidance that allowed Social Security beneficiaries, to automatically get the payments, the COVID-19 stimulus payments, that sort of thing it gets changed in the updates. You don't have to worry about that. But we really encourage you to continue to reach out to your members of Congress. And in addition, there's the campaign is asking people to post videos or pictures of why you are essential, and use the hashtag We Are Essential. We had a great number. I think there was, and this was over a week ago, was reported by the ARC of US that there were over 33,000 points of contacts from the constituents of the ARC that messaged their members of Congress. So I'm sure it's a lot more by now, but it's by far the most that the ARC-of-US has ever had. So please continue to do the great work that you're doing and spread this message that we're essential. I just want to note that Congress, they're currently in their districts and states until April 20th. And so the part of what we're asking too is that they get back to DC sooner to address these really important issues that are putting a strain on our Medicaid systems and our DSP workforce.
Okay, great. Thanks, Ellen. This is Carrie.
Okay.
And did you want to go through the state advocacy? We've got a couple questions.
Okay, so this was something that Maura Sullivan, our Government Affairs Director, has covered. I just wanted to remind people that people are, that the State House is still functioning, and they're hearing from other people in their district about the impact of COVID-19 on them, and we just want to make sure there's a strong voice from the disability community. So just want to remind all the things that are going on, and we continue to provide updates around all the issues that the families are dealing with right now. So I list some of the priorities right now that we need to be reaching out to our state legislators about. But yeah, I can take some questions. I wasn't sure if we were doing it at the end or not. I can't.
Yeah. Do you have more slides? I'm sorry, I thought you were done.
Oh,
anyways,
no. Well, yeah, I wanted to talk about a few other issues, but around the census and rationing of care.
Okay. So how about I just give you a couple of the new questions, and then we can get back to it.
Okay.
Alexandria has a question. With the new COVID package, can a parent go with their child or adult with disabilities to the hospital if the direct support professional is unable to go?
So that I know that there have been issues. This has come up before, that in Massachusetts hospitals, I think, under the package, they should be able to, if they're, receiving HCBS services, that is something that is included that has not been included before. So they should be able to, and I would make sure and check with the hospital if you can. I mean, I know there's obviously emergency circumstances that happen, but that is something that should be allowed. But we need to continue to educate the Mass Health, and we need to educate our hospitals around this guidance, because it is so important for people with disabilities to have that support and help in the hospital. Okay,
thank you. And from Josie, is anybody looking at the bills already in queue that address some of these issues, like the SSI Restoration Act, the
Yes.
Empower Act? Okay. All right, great. Okay, so I'm sorry, why don't you get back to your presentation?
Well, how am I doing on time? I'm sorry, there was so much to cover.
I know it.
Yeah.
So anyways, yeah, so why don't you get back to it, and we'll see if we can take questions
at the end. Okay. Well, so I did so again, Maura brought this up yesterday on her call, but I just wanted to highlight, because it's such a huge issue for us around rationing of care. And just make sure that that the ARC is on this, and that we are a part of a coalition that's led by the Center for Public Representation, and several other disability groups are working on this to ensure that the rights of people with disabilities are protected, and their states are not discriminating when making medical treatment decisions. There are a lot of fears that state and medical professionals, and they have done this in certain states, they've provided, guidance for rationing acute medical care. And for instance, Alabama's triage plan provides that people with severe, profound intellectual disabilities are unlikely candidates for ventilator support. And Tennessee determined that people with spinal muscular atrophy who need assistance with daily activities will not receive critical care if the scarcity becomes dire. So the CPR coalition has filed complaints in several states about this illegal disability discrimination and treatment rationing protocols. And the Office for Civil Rights at the HHS did issue important guidance surrounding this. And we just want to make sure that states follow through on this guidance to affirm that the disability right laws apply to decisions around accessing life-saving COVID-19 care. So that is an important issue for us, and we will continue our advocacy around that. And then I would be remiss, so I had a webinar on Wednesday about this, and if I really welcome you to go check it out on our webpage, arcmass.org /census. But I just want to plug that, Census Day was on April 1st. It's super easy to do your census survey. It's safe, easy, and important. You can respond online now. It's the first time ever you can respond to the decennial census online and then also by phone or by mail. But it's a big deal. It determines the number of seats each state has in the U.S. House of Representatives. 2010, we lost one representative in Massachusetts, so we went from 10 to 9. So it's a big deal that we get it right. It also defines congressional and state legislative districts, school districts, and voting precincts, and it determines the allocation of over $675 billion in federal funding. And it's really important for people with disabilities because we're considered a hard to count population and they're at higher risk for being undercounted. And we want to make sure, given the circumstances right now, that we're getting this message out as much as possible on social media and online. All of our ways of doing outreach are limited now. So we really need to get the word out for everyone to be counted. And then I just wanted to mention, get out the vote issue. The ARC is a part of the Rev Up campaign in Massachusetts at the website there. And we want to make sure that anything, possibly in the fourth package that Congress does, that there's additional funding to states to ensure accessible voting as states are moving to absentee and mail voting. But obviously getting out the vote for the disability community in the next presidential election is very important. And then I just wanted to remind everyone that the ARC of Mass is, working hard to try to help our community and provide updates on a variety of areas, ranging from, just what's going on in your daily life to financial matters to the many different policies that are happening in the state and federal and local level. So be sure to check out our webpage and join our listservs and to get the latest updates on what we're doing and what our community is up to. And then I just want to list our weekly webinars that we're doing. And on Monday, Tuesday, Thursday, and Friday, and different updates from our staff. And there's my contact information if you need it. And then I just wanted to mention, we would love your support as well, and all the important work that we do. So thank you. Are there any additional questions?
Okay, thanks. Okay, thanks, Ellen. We do have one from Alexandra. Okay. Thank you. I'm sorry. I just wanted to clarify if a family receives HBCS services, if the direct support professional is not able to go, is the parent able to go?
That I'm not sure about, and I can get back to you about that. That's a really important question, and thank you for asking, because we are hearing different things from hospitals about not allowing other family members to join a loved one in the hospital. And obviously there's safety concerns, but I think for members of our community, it's really important to have an advocate there with them if they're not able to communicate. So it's something we're looking into, but I am not sure about whether family members, that's not directly included in the package that the third COVID-19 package, the CARES Act. But that's a really important issue, and again, we'll continue to address it. This came up on our last call with Maura yesterday, so I know this is something that we're looking into.
Okay, thanks, Ellen. How about anybody else? Anybody else have any questions? Rebecca just said thanks very much. Very, very informative. Nancy is asking about access to the PowerPoint. You'll all receive a copy of the PowerPoint after this webinar is over. Anybody who registered. All right, anyone else? Wait a couple minutes. Just chat in your question. All right then. So at the end of this webinar, you're going to be rerouted to a brief 10-question survey, and we hope you fill that out and let us know how we can improve our webinars, and also if there's any topics that you really wanted to know about. So thanks again to all who joined us today, and thank you, Ellen, and everyone stay well.
Thank you so much.
Thank you.
Thank you.